Good morning, Dr. Rosensweet.
Good morning, Carolyn.
It is very nice to see you, as it always is.
Fancy meeting you here.
I know it's strange. There wasn't much traffic this morning, so it's very easy to get from room 1 to room 2.
Exactly.
We love the way this works, right?
Yeah, exactly.
So I'm welcoming you, of course, and I'm going to welcome anybody who's going to be coming up, men and women alike. And it's been kind of a busy Facebook morning for me, for sure. And I have these questions here that are, I believe, going to be addressed in just a second, correct?
All right.
All right.
I'm ready.
Give me one sec.
Sure.
Sorry. Wait. Okay. Have to have some liquid because my mouth gets dry. Okie dokie. So, question number 1, Dr. Rosensweet, comes in from a woman who says, "Good morning, Dr. Rosensweet. I am 47. I am perimenopausal, and I've never been to a doctor, and I've never taken any medication for my perimenopause. I have all the symptoms," and she said 40, 40 of them. Well, understand that. But I'm really afraid to take any medications for this. Can you help, please? I'm so concerned, too, about waking. Ooh.
Yeah.
Yeah.
Sure. Absolutely great question on the minds of so many women and men.
Thank you so much.
Let me approach it from a couple different angles. Menopause, perimenopause is all about hormonal decline biologically. A young woman has her highest hormone levels in her whole life, the age of 20, plus or minus a couple years. And they start declining. The ovary is really putting out a rich amount of estrogens, testosterone, progesterone, DHEA. But it starts declining. Hormonal decline. Other hormones have known throughout medicine to decline. For example, it's been known for probably millennia or centuries for sure, the details that adults can have a declining amount of thyroid hormone and not have sufficient thyroid hormone. And they pay a price for that. Thyroid animates metabolism. It's through metabolism that we produce energy to run our whole everything. And thyroid has a direct influence. It's like the gas pedal to energy production. And when thyroid hormone levels cease to be robust, like they are in most young people, and they start declining, oh my goodness, nothing works. The immune system doesn't work well. The intestinal tract doesn't work well. You get constipated. The skin doesn't work well. Nothing works. And you wake up tired and, and I'm mentioning this one because it's a very, very common example of hormonal decline. And there isn't, I would suggest there isn't one single medical doctor or naturopathic physician or osteopathic physician or nurse practitioner or physician's assistant on the planet Earth who wouldn't hesitate to gleefully, joyfully come in and try and make up the difference between what the gland was putting out and what the patient actually needs. by writing a prescription for thyroid hormone. Oh man, it's been done rigorously in the United States since the relatively early 1900s. And there's examples of thyroid hormone being replenished before that. In fact, thyroid hormone is one of the most popular medications produced by pharmaceutical manufacturers. Now, why in the world, if a man's testosterone declined or a woman's estrogen, progesterone, testosterone, and DHEA decline, more going on there in a woman.
Yeah.
Why in the world would anyone not want to do the exact same thing we would do with thyroid hormone, replenish it, because we have access to really wonderful replenishing tools? Well, there's a reason why, and it's a bizarre reason, and it's a false reason. Or let me preface this with, women's ovarian hormones have been replenished to the women in menopause for about 1,000 years. The Chinese aristocrats started doing it 1,000 years ago. In the 1950s, the pharmaceutical manufacturers learned how to acquire large amounts of estrogens, and they started producing estrogens in pills. And millions of women were on these pills. And in fact, 18 million women by 2002 were on these pills. That's 40% of American women in menopause were on these hormone replenishing pills.
Right.
Known as Premarin, because they were derived from pregnant mare urine, or they were on Prempro. So this was a totally familiar thing to do. 40% of American women in menopause, 18 million American women were getting their estrogens replenished, and we're getting this molecule called progestins. Man, it was the most popular and profitable pharmaceutical manufactured medication on the planet Earth at that time. So what was being done with thyroid was being done in spades for women with Premarin and Prempro primarily. Now, there was a small number of folks in the United States and even in Europe as well who were getting the idea that maybe we could find pure molecules that were exactly copies of what the woman's ovaries produce, otherwise known as bioidentical hormones. And this was being done, but it was minuscule amount. Premarin and Prempro were the leads. And then a catastrophic event took place in medicine, unlike anything I've seen in my 50-plus year career. A false scientific report was published, shouldn't have been. Even the last-minute publishing of it was fought by several members on the very study committee that was involved with the report. And it was such bizarre news, it was such shocking news, that as can occur in the United States and probably other countries on this planet, it exploded out into the public. And American women and American physicians and nurse practitioners and health professionals got scared big time, because this report falsely reported that one of the two hormones being administered to women in menopause, Prempro, the false report was there was an increased incidence of breast cancer, heart attack, and stroke. But when you read the study, it said that increase was statistically insignificant in the study.
Right.
But you have to understand science to know what statistically insignificant means. And it's not rocket surgery to understand that means no good, nothing. Draw no conclusions. It's statistically insignificant. Forget about it.
Zero.
Publish this thing. Well, they published it anyway, and it's exploded like wildfire. And it scared people all over the planet. So much so that 18 of the 18 million American women who were being treated, it dropped down to way, 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 way low.
That's a lot of women.
That's a lot of women. And of
Yeah.
course, there was mega consequences of that. And into the years following, these women, the consequences of loss of bone, loss of mind, loss of muscle, loss of everything was documented, including the loss of life that occurred from that particular publishing of that study falsely. Well, when I read that study, I was alarmed too in 2002. I had been treating women in menopause for 10 years by then. I was using compounded bioidentical hormones. I was reassured by the European literature that they resulted in reduced risk. So I kept on going. And colleagues pointed out to me that there were so many faults in the study, not to even mention the statistically insignificant part. And so many of us were reassured, and we just kept on treating as didn't drop a beat. Definitely did not. And that's why this woman is scared. Because that misogynistic event, I'd like to editorialize. It's so crazy when you wind up hurting millions and millions of women, no matter what you want, however you want to slice it. It's really bad news. It was bad news. Well, a lot of these women had such trouble navigating in their lives that they would seek anything, and compounding bioidentical hormones were on the rise. And by 2016, there had been a recovery. About 6 million women in the United States were being treated. It used to be 18.
Right. I was just going to say.
About 6 million. And what was discovered in a medical study, that over half of them were on compounded bioidentical hormones. They had found their way to compounded bioidentical hormones. And in 2017, the original study committee that had published the Women's Health Initiative in 2002 that scared everybody published a retraction saying this: after 18 years of follow-up, there was no increased risk in breast cancer, heart attack, and stroke in these women.
It's so sad.
And it's so sad. And what continues to be sad is, although the planet Earth, the pain that it caused around the Earth in 2002, and how popular that false finding was, there's very few people who know about the retraction. Now, more and more are. There's a wonderful book written by your father's childhood friend and oncologist, Avram Blooming, and Carol Tavris, that you found and connected me with. I'll be forever thankful for that. Carolyn Shapiro, I'll be forever thankful for that. Did I say thank you for that connection?
You did indeed. And he is a brilliant man, and Carol Tavris is right up there too.
Yeah.
Yeah. And it was good to see him again.
And they published a book called Estrogen Matters, and the actual science involved that, and this is the science. So this is what I want your questioner to hear. This is the science. Always was the science, is the science now. That we're all at risk for thousands of diagnoses. Some of them not pretty.
Yeah.
We're all at risk for cancer. As a man, I have an increased risk for prostate cancer, and there's reasons for that. And women have increased risk for breast cancer and uterine cancer and ovarian cancer, and there's reasons why this risk has increased over time.
That's right.
Taking that into account, women who are treated with hormones are at less risk for breast cancer, heart attack, and stroke than women who are not treated with hormones. That's the science. And really, this science is based on Premarin and Prempro. Need I say more? So if you're safe with Premarin and Prempro, you're at less risk. If you're a woman, if you're treated with hormones, than if you go untreated. And the flip side of that, and this is one of the things that so many women found out, is there's not a risk, there's almost a near certainty that if you're not treated with hormones, you're going to lose bone, muscle, arterial health. So many of you are going to lose cognitive function. Sometimes you're going to get major losses of cognitive function. Vagina, bladder, libido, skin, on and on and on. These hormones are so powerful and they have so much effect. So, yes, we're all at risk for stuff, but there's a near certainty that if a woman is not taking hormones, this is what's going to result. And if you want to know why there's assisted living facilities and nursing homes and adult diapers and wheelchairs for the elderly, this is the major reason. These women did not get treated with hormones. And the flip side of that is, if you'd like to give yourself the very best chance in the world of not having to leave home, not having to go into assisted living facilities and nursing homes. I know I have nothing, I bless deeply the wonderful service of all those involved in providing professional assisted living and nursing home care. Oh my God. However, if you're one of those who would rather not do that, get on the hormone jet plane, I'll tell you. It's not a chance type thing. It's like, if you don't have these hormones, the likelihood of you losing your muscles, ask any gerontologist, ask any medical doctor that is specializing in the treatment of the elderly, and they will tell you that the elderly lose bone health, can fracture hips, lose muscle health, can lose the ability to stand and walk, can wind up in a wheelchair after a cane and a walker. Ask any gynecologist about what happens to a woman's vagina and her bladder when she's not on hormones. Ask any cardiologist what happens to the risk for women in heart attacks. Ask any neurologist what happens to a woman's cognition without hormones. So it's a big deal. So again, to answer your question, we understand why you're afraid, but because that got so pervasive in society, mention hormones to most women and most doctors, and you hear, oh, don't do that. You're at risk. And
9 times out of 10.
That's right.
Yes.
And so we want to antidote that. And that's why I've taken so much time on this particular question. And I'm happy to answer it as many times as it comes up on our Facebook Live, which next Tuesday, I have a very special event taking place Tuesday morning. So I won't be here next Tuesday morning, but I'll be back a week from today.
You will be in our hearts.
Thank you.
You are so welcome. It's very exciting. So we will not be here Tuesday, you guys, but that's okay because we'll be here on Thursday. Lots of good things happening. You know, you do bring that up. I do work with a lot of people, so I see this transpiring. Women getting thinner and thinner and thinner. I mean, teeny, tiny. And I know. And I keep my mouth shut, you know, in the main, because it's none of my business unless I'm asked. Most people know what I do. I get knocks on the door, happily so. But it's really sad to me, just to see people kind of like wasting away when they don't need to be wasting away. Good morning, Carol Ann and Melissa and Iowa and Sarah. Thank you for being here. Thank you for that answer, Dr. Rosensweet. I'm gonna circle back to a part of that question. I'm gonna move on to question number 2, because you just kind of touched on this. And the questioner is saying, hi there, can a woman who has had a stroke or a pulmonary, is it an embolus? Or
Yeah.
Embolus, take hormones? And are there any tests that one can take prior to prescribing compounded bioidentical hormones?
This is yet another good question.
Mm-hmm.
And what it pertains to is, I think it's the majority of strokes are caused by a blood clot in the brain. And the pulmonary embolus is a blood clot that has occurred in the lungs.
Right.
And the pulmonary embolus comes from a clot that usually forms in the lower extremities, the veins of the leg, breaks loose and travels up and goes through the natural pathway through the heart right to the lungs.
Yeah.
These are very rare, relatively rare, but very important issues to consider. We first had an unusual need to consider them when the birth control pill came out, because a certain number of women taking the birth control pill actually got clots in the veins in their legs, something called thrombophlebitis. And in some of those women, those clots broke loose and went to the lung. And they got a pulmonary embolus, and that's very devastating to a lung. You can lose part of your lung
Right.
off the blood circulation. And this is a well-known complication of the birth control pill. And when someone has had a stroke and they want hormones, because we knew there was problems with the birth control pill, we want to do an evaluation. Now, the medical literature is full of references that say that the cause of the birth control pill clotting issue was the result of estrogens being given orally by mouth, because the birth control pill was a pill and you swallowed it.
Right. It wasn't topical. Not that I remember.
Exactly. And oral estrogens are a story all of their own, because when you swallow something orally, it goes to the liver first. You got to take much higher dosages of oral estrogens than you do when you apply them to the skin, because in the liver, a certain very high percentage of what you swallowed gets metabolized. It gets biochemically transformed into products that are not hormonally active. And so you got to eat a lot more estrogen to get some of the estrogen through that liver and into your body. And again, the medical literature declares that increased coagulability, the increased propensity for blood to clot, when it relates to hormones, is coming from estrogens taken orally. Now, in medicine, there's all kinds of exceptions. And I'd like to mention an exception of Nancy and Denise. It'd be a miracle if you were out there, Nancy and Denise. I remember, I can picture the two of you like I can picture Carolyn right now. These are two women that when we started hormones and we put them on topical estrogens, as we always do, each one of those said to me in their own way, not at the same time, wow, my leg's a little uncomfortable, just like it was with the birth control pill.
Ooh.
And the other one said, wow, my leg's uncomfortable. And, when this happened when I was in the birth control pill, and that went on to give me a pulmonary embolus. So, although theoretically we wouldn't consider topical estrogens to be a problem, you never say never. And I know that's an exception to what is commonly known in the medical literature, that it's all about the oral estrogens. But I wanted to give you those exceptions. So I want to talk a little bit about coagulation. We have this just elegant, exquisite, and complex system to get blood to clot. And it takes many, 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 many biochemical steps, and it's rather staggering for anyone who wants to study what goes on to get blood to clot. It's amazing. And of course, you'd want it delicately poised, because you wouldn't want to clot too easily, No, you'd want to spot on clot when you need to clot. Or you wouldn't want to not clot properly. You could bleed. And there are illnesses that people don't clot sufficiently and they bleed. No, you want to be spot on. Well, it turns out, in general, the American public is leaning towards hypercoagulability. What? Instead of
Yeah.
being delicately, perfectly poised, the American population in general is leaning towards hypercoagulability. And that is being provoked. And that's being provoked by, for example, certain an immune system that's not fully up to par, and some of the critters, the bacteria and viruses that are part of us, they're not getting controlled as well, and they can provoke hypercoagulability because the clotting mechanism is involved in the immune system to tie them up. One of the most primitive ways of taking care of a germ is throw a clot around them. So I know I'm going deep into the weeds here, but this is a subject that matters to us. So we take a very, very thorough medical history, as almost any physician and nurse practitioner does. And if we hear a story like the questioner had a stroke, well, we want to know how did they have that stroke? Did they have a clot or did they have a hemorrhage? What was the deal? And we proceed regularly and routinely. We just take a preliminary path with these women. And here's what's involved in that path. We draw some blood and send it to one of the two major laboratories in the United States, because they are exquisitely set up to give as much information about the coagulation method as we want to ask them. In fact, there's a lot of moving parts there. It's quite an extensive a series of tests that they do on blood to see if a woman has increased propensity to clot. And so we always do that up front. We delayed the treatment of a woman in menopause that I heard from this morning. Hello, if you're out there. We've been texting back and forth this morning. And we delayed her process 3 months before we actually got the hormones going, our hormones going, because we wanted to evaluate her coagulation mechanism, because indeed she had a stroke. And now, if someone has evidence of increased propensity to clot, hypercoagulability, it is fairly easy to treat this. There are so many nutritional supplements that will thin that blood out and make it less prone to clotting. And if not that, there's some really extremely popular medications that reduce the ability of the blood to clot, including even baby aspirin. That does do a certain thing to a certain element of the clotting mechanism. So it's not like if you have an increased propensity to clot, that's the end game. Not at all. We just do what it takes and retest you to see if we've thinned that blood out, so to speak, so it doesn't have an increased propensity to clot. And I want to tell you, with omega-3 fats, supplementation from vitamin C, from vitamin E, we can thin someone's blood out so much, a lot of people, that they're going to get bruises on the back of their hand because they're leaking through the capillaries because they're not clotting like they should.
Yeah, we talked about that last interview.
And you can get more sophisticated than that. You can use these enzymes to thin the blood out, and there's pharmaceutical medication that they do the job, including baby aspirin, Coumadin, heparin. There's no need to be hypercoagulable under the proper care of someone who knows what they're doing. And that's when we would begin. Now, we would always treat with topical estrogens for certain, so that risk would be extremely low. I had 2 patients out of 25 years of treating women in menopause. So, you run into exceptions when you're seeing that many patients.
That was Denise and Nancy.
So, yes.
May I ask this question that just came up? Dr. R, are birth controls not safe, especially for young women over time?
Well, the birth control pill has revolutionized the planet Earth. To give the woman the power to delay pregnancy until she's really ready is a phenomenal gift. Oh my God, the planet Earth needs birth control of that magnitude. And so I have deep gratitude in my heart for, 50 years now? I think it's somewhere over 60 years, something like that. And all the women that were given the chance to choose and control when they wanted to get pregnant and have a baby, and choose when they're ready to get pregnant. And I don't think there's been anything as influential as the birth control pill. And because I interview so many women and do medical histories on so many women in the perimenopause, oh my God, I'd have to guess that it's a wild guess. In my practice, I'd say 75%, 80% of the women that I've interviewed, were you ever on the birth control pill? Yes, I was.
Yes, yes.
And not only that, we also have questions on there. Did you like it? Did you have any trouble with it? Tremendous number of women liked it, had no trouble with it whatsoever. And so I have deep gratitude for the birth control pill. And at the same time, it can have its consequences. They're not universal. It's like anything else that's strong. I mean, you want to hold back ovulation in a woman? What does it take to do that? I always thought it was a phenomenal misnomer to say low dose birth control pill. Yeah, they were low dose compared to the original pills, which were higher dose. But you think of the potency of hormones that you have to administer to a young woman to hold back ovulation and to fool her body that she's pregnant so she doesn't ovulate. Oh my God. Don't think you're not talking about power there. And some women have complications from the birth control pill. There's a certain percentage of women that they just don't feel good on them. They just really don't like them. And so there's many stories of women getting on and getting off because they just didn't feel good. There's a lot of stories of women losing their libido when they went on the birth control pill. That was called an unwanted side effect for many of those women. They thought they were freeing themselves up for sexuality, but at the same time, they're losing their libido. Well, let me address that one, because here you have a young woman at the peak of her hormone output from her ovary, because she's young. And it's in the beginning that the ovaries produce their maximum amount of hormones that they're going to do in your whole life. And then you're taking a pill that has hormones in it. Estradiol, for example, the strongest thing, estrogen that the ovaries put out, and a progestin. So that her body registers, gee, my estrogen level's too high. I want to protect myself from excessive dosages. Well, I can do that. I've got a very simple physiologic protection mechanism. I'll increase the binding hormones that transport these hormones around through my bloodstream. I'll increase something called sex hormone binding globulin. And sex hormone binding globulin that increases in a young woman on the birth control pill has a stronger affinity to testosterone, so it's going to bind up that woman's testosterone, and she loses her libido, or gets diminished libido.
Yes, that's birth control.
Yeah, that's birth control.
Yeah.
And as an aside, theoretically, when a woman stops taking the birth control pill, she no longer has excessive estrogens. So that sex hormone binding globulin should go back to normal. And it does. However, it also doesn't in many women. It stays elevated and gives us trouble in hormonal administration in the perimenopause and menopause. Now, we can work with that trouble, and we do. There's a medication called danazol, which when given to men or women who have elevated sex hormone binding globulin, because this can also occur in men, it will reduce that sex hormone binding globulin. So I'm mentioning this because we bump into the vapor trails of birth control pills in the perimenopause and menopause often enough. Now, your question is, are birth control pills not safe? The actual complications that are of greatest concern are those increased coagulation in the clots. And for most of the women who get those clots, and they're still relatively rare, they occur in the leg veins. You stop the birth control pill, the clots eventually heal, and you're done. For some of those women, it's rare, but that clot breaks loose. You get a pulmonary embolus. You can get permanent lung damage from that, or you can get non-permanent lung damage, but it can sure knock you into the hospital for a while. Thank God for hospitals in circumstances like that.
Yeah.
And so it's like so many things on this life on earth with us human beings. It's a risk-benefit analysis. Now, when I was growing up and coming of age as an adolescent, there was no such thing as birth control pills. Think of that. I'm BBCP. I'm BBCP. I was born BBCP before the advent of birth control pills.
I'm going to write that down. Dr. David Rosensweet.
Almost BC. So, and lo and behold, I, as many young people, thought the sexuality was just phenomenal. And my parents took me to a talk on sexuality in a town. We grew up in Detroit, and we had to drive to Flint to hear a sex talk by some PhD back in the 50s.
I love that.
Oh God, it was a little scary how it took place here. But they took me there, and I was grateful to hear this very official education on sex education. And we were highly encouraged. My father, bless his heart, took me aside and said, listen, you don't want to get a woman pregnant until you want to have a baby. So here's condoms. They've worked for your mother and I flawlessly. And he introduced me to condoms when I was very young. And oh boy, did my heart flutter. I'll tell you, these were concepts that I could hardly take in.
Well, you were 6 years old, for God's sakes. I mean, what are you going to do?
That's probably 11 or 12.
I know.
We had a phenomenal birth control pill when I was growing. We had a phenomenal birth control method when I was growing up. There was no woman that I would encounter in my life that would ever dream of getting undressed. It didn't mean that and I know there were exceptions to that. I'm sure we'd get a lot of pushback. But that was the major birth control pill when I was an adolescent, was this note. And I remember once, here's in full disclosure, I wildly went to unbutton a button, and with someone that I was having just a phenomenal intimate experience with. As soon as I touched that button, it was all over. Abrupt halt, no. And that was it. I just ruined my whole evening. Now,
Daryl is still traumatized.
Now, having said that, because I grew up in an era where there was, from the women that I was encountering, the young women I was encountering, this was not a question this was not a possibility. I know there's exceptions out there, but who I was encountering, there was no exception. But it didn't matter to me at all, because the amount of intimate pleasure that we could have was just off the charts. It was just mind-boggling. So did it affect me really? No. When you don't know what you can't have and you're having the time of your life.
Right.
I think I might be wandering a little bit in this question about birth control pills.
Well,
but what it led me to especially the more education I had in medical school, was I became a fan of this combination of diaphragm and condom. Because when I was in my 20s, I was introduced to the diaphragm, and back in that day, diaphragms were extremely popular and very effective. Now, diaphragm and condoms don't have the same level of protection, but it is way up there. You can go a long way with a diaphragm and condom, and also the spermicide that's used. Again, risk benefit. And I became an advocate for those who really wanted to be careful, is to use diaphragm and condom. And back in the original day, it wasn't a big deal because I didn't hear this thing from men. Oh, I can't feel a thing, which I thought was insane because I personally could feel so much I could hardly contain myself, and often didn't. Is this too much for our Facebook Live, Carolyn?
Well, this is the sex education ins and outs of menopause group this morning. For adolescents only.
For those who have difficulty with the birth control pill, there are time-honored other effective birth control measures that, to me, they were the only things available, and they worked. Now, the birth control pill has an astoundingly high protection level, and these others, they come close enough. So, at any rate, there's a variety, and here's where we come down to the basic principle in medicine, and the basic principle in birth control pills, and the basic principle in menopause and perimenopause is every single situation needs to be individualized. And do I bless Planned Parenthood? You just got a taste of my politics. I think they've just done wonders on this planet to protecting young women from not having to get pregnant until they want to. And do I think this is a major benefit to the planet Earth? I do. So it's up to each woman to choose. And it's funny, attitude plays into this too. There's so many women, they never thought twice that birth control pill would be a problem. And they had fantastic results, and they got pregnant later, and they never blinked an eye and never thought back. Whereas
right.
if a woman's really concerned, well, the name of the game always, it's individualization. But there is a way to have effective birth control pill, and I didn't mention IUDs, which are very effective, intrauterine devices. So there's a lot of choices, and someone who's knowledgeable, a healthcare professional who's knowledgeable in contraception is going to help guide you based on your individual preferences, compliance. There's a lot of wonderful choices in birth control. I would birth control pills. I know there's a place for them on this earth, big time.
Right, and I'm kind of wandering as well. However, I think it's important because there are women that will write that they're using birth control for their hormones.
Well, it's better than nothing in perimenopause, because what's perimenopause about? Well, after all these years, the hormone levels have just dropped too low. And yeah, you're still menstruating, you still got enough, but hey, give me some hormones of some kind.
Yeah, right.
And that I find, if you have nothing else on the planet, that would be reasonable. But there's so many wonderful and specific choices called compounded bioidentical hormones.
Absolutely.
And I never, ever would personally prescribe birth control pills for a woman in perimenopause, because there's so many elegant, exquisite, highly precise, laser-focused options that we do, for example, in the menopause method, and download our book, Happy Healthy Hormones, no charge. You'll learn a description of what's really available. And so that's what I have to comment about the use of birth control pills.
Well, I think
better
that
than
was
nothing.
an amazing answer that took us around the world. And that was a good one. Okay, so thank you, Dr. David Rosensweet, for that. Now, big question. Women complain of feeling dizzy, off balance, like this vertigo kind of weird feeling, especially when they're in menopause. Have you ever heard of this from your patients?
I have, and not uncommonly. And not commonly either. And there's a lot of causes of dizziness, and some of them relate to hormones and some don't. So it's like any other symptom that arises. You follow the bouncing ball. If it's really interfering with your life, or you're interested in dealing with things when they're subtle, which is a great idea, you look at the various possibilities. Healthcare professionals like physicians and nurse practitioners are trained in doing a process to unravel the causes and do the treatment for something like dizziness. And it can take you into many different specialties, including neurology, the study of the nervous system. However, there's a very common lightheadedness or dizziness that occurs around, it's really midlife. It's not so much that it's menopause. It has to do with, like, if someone is lying down and resting, and you stand up really quickly, by gravity alone, the blood rushes to your lower extremities.
Right.
You can get faint or dizzy. Well, we, of course, have had to adapt to this genetically for 200,000 years. If we were resting on our rock, do you remember that, Carolyn, when all of
We
us
first met?
all of us would lay down on the warmest rock we could find and the smoothest rock we could find?
Remember it well.
Lay our javelins by our side in case anything untoward occurred in the night.
Huge club.
Oh, yes. Club. Club on one side, javelin on the other.
Because we know that Tyrannosaurus Rex was right around the corner.
And I'm sure we had this fantasy that if a Tyrannosaurus Rex came upon us, we could just stick the club right in their mouth as they're about to chomp us.
Well, at least divert them.
Highly effective. It's like a tongue depressor. Makes them gag, freaks them out, they run in the other direction.
My dad had one of those in his little black bag, I remember. That's silly. So,
it's so wonderful that we cover anthropology here. I mean, there's just a wealth of information about anthropology. Now, if we were lying on our rock,
yeah,
and we got up really quickly, we wouldn't want to be dizzy. And so we have adapted, and we have these wonderful biochemicals that immediately or instantly in our nervous system instantly goes into action.
Yeah.
And the blood vessels to the lower extremities are squeezed tighter. And that keeps the blood up in the upper extremities and up in the head. And this is done through the sympathetic nervous system. And key to the sympathetic nervous system is also a hormone called adrenaline. Well, if someone is banging at their adrenal glands over and over and over again, and keep on calling forth the biochemistry of fight or flight, they are compromising their adrenal glands' ability to put out these hormones. And there's a certain number of people that they have what is commonly known as adrenal fatigue. I think that's a pretty decent name. They're not putting out enough adrenaline, and they start getting lightheaded and dizzy when they stand up, otherwise known as orthostatic hypotension.
Right.
And sometimes you got to go on an adrenal gland recovery program for that. I'm not going to go into that. And that's occurring, midlife. Now, I've heard dizziness coming from hormones. A woman who's on too much progesterone is going to get dizzy or lightheaded.
Yes.
And there's some dizzinesses that occur in the perimenopause that on women who are being treated with hormones that at first glance are baffling. Why are they getting dizzy here? But there's a common approach that we use is we effort to get a woman into exquisite hormonal balance and optimal levels. And we know how to do that. And then see what's left. So rather than pondering and doing a lot of neurological medical diagnostic workups, no, we don't start there. If the woman didn't have dizziness prior to perimenopause, or she started to develop it once she went on the hormones, if she never had dizziness at all and she went on the hormones, something is wrong, because the only thing that we accept with hormone replenishment is you feel better.
Right.
And you feel good. And you don't have side effects. If you're having other effects other than feeling good, feeling better, your program isn't up to speed. And sometimes hormonal programs are a piece of work to get adjusted properly. So that's okay. That's it's all part of it. You know, it's all part of it. It took 20, 30 years to get unadjusted, and all the internal imbalances and stuff. And there's so many factors that coming in from our environment that disrupt hormone function. And there's the receptor site issues, and there's the sex hormone binding globulin issues. So sometimes it's a piece of work. But the strategy is, if a woman never got dizzy and she went on hormones and she's getting dizzy, something is wrong. And it may be that the hormones aren't adjusted properly. Duh.
Yes.
So we work there.
Yes. Yes.
And we do see it. And that was your question. Yes, we do see it. And we keep on adjusting, tweaking. It's why it's critical in menopause to work with someone who knows how to individualize your body, because every single man and every single woman, we differ as to how much we need of anything, how sensitive we are to anything that we're given, how well we absorb various things. And I think just as powerful, as significant is what our own internal balance between 4 plus 2 or 3 other hormones, but estrogen, progesterone, testosterone, DHEA, thyroid, cortisol. Yeah, this is a piece of work to get these properly leveled and balanced, dialed in.
Right. And so the bewitching hour is coming upon us. I'm going to get to this because it's important. This one woman says, and I want to address someone on the chat. She has out of range DHEA levels, and her testosterone is high, but all of her other hormones are really quite low. And she is wondering, and you just mentioned adrenals, caught my attention. And she said, all of this is prior to taking any CBHRT. She's doing this all on her own. And she wanted to know if this could be indicative of an adrenal issue.
I must say that it stands out to me that she was doing it all on her own. It took me about 15 years before I started feeling like, wow, I'm getting this. And I went to medical school.
One of the slower ones.
And I went to medical school, no less, which is one of the most royal educations and sacred educations that I could imagine.
Oh, you bet.
But here's a common thing that happens to women. And I'm going to make a guess at her age that she's in the perimenopause. So she's in her 40s or early 50s or late 30s. But it doesn't matter, because as the ovaries start declining in their ability to produce estrogen and progesterone and testosterone and DHEA, this is unacceptable. And there is a compensation mechanism possible. The adrenal glands also put out androgens, testosterone and DHEA. And there's some women, when they go into the perimenopause, they can compensate for low estrogens which their body does not like, by increasing the adrenal output of testosterone and DHEA.
Right.
And here's why: because the biochemistry is so intricately interconnected, it's staggeringly sophisticated. A woman can produce estradiol by converting testosterone into estradiol.
No, it's
That's a compensation mechanism that can take place as she's losing her ovarian estrogen. There are some women in the perimenopause. I spoke to one yesterday, but I've heard this over and over and over again. Women who develop hair on their chin and a mustache and acne as they're in the perimenopause, because their androgens are increasing. Never had a pimple since I was 14. Pimples again. Hair on my chin. Yikes. What is that? Hair on my mustache area. I've heard this many times.
right.
A natural compensation mechanism for some women as they go into the perimenopause is they can increase their adrenal androgens and convert some of those androgens directly to estrogens. Oh my God, it's amazing. Now, that does not last forever. And by 3 years from the last period, I've tested thousands of women. There's not a single woman that I've ever tested that has adequate androgens anymore. And this phenomena that's taking place, it used to be far more common 25 years ago in my practice. I used to see that compensation, the increase of the androgens temporarily. I don't see it very often. And I think it's because we're living in an era where the stress response is ramped up. And so, yeah, women might want to increase their adrenal androgen output to compensate for low estrogen by increasing their testosterone output and converting some of that to estradiol, but they can't because they've also fatigued their adrenal glands. So I think it's less and less common, and that's my story. And oh my goodness,
You're gonna stick to it.
We're gonna stick to it. It's time with what I have going on this very day for me to say hasta la vista.
You're gonna bid us adieu.
Yeah.
Okay then. I'm gonna wish you an extremely wonderful, fabulous weekend and week.
Thank
We
you.
will be back on. Oh, you're so welcome from my heart to yours. And we will be back next Thursday. We will get to these questions. And, everybody have a really great weekend. Wonderful interview, Dr. David Rosensweet.
Thank you, Carolyn Shapiro.
That's right. That is my name. So.
Okay, until next Thursday.
That's right. Enjoy, have fun, be well, be safe, laugh a lot.
Good idea.
Yeah, huh?
Good idea. All righty. Bye-bye, everybody.
Bye.